Sildenafil is a medicine that belongs to a group of drugs known as phosphodiesterase type 5, PDE5 inhibitors, which also includes medicines like avanafil, tadalafil, and vardenafil. These medicines work mainly by relaxing and widening the blood vessels in the body, a process known as vasodilation. Because of this effect, sildenafil increases blood flow to certain parts of the body. It is most commonly known for treating erectile dysfunction, ED, a condition in which a man has difficulty getting or maintaining an erection suitable for sexual activity. Sildenafil helps by increasing blood flow to the penis when a man is sexually stimulated, which makes it easier to achieve and maintain an erection. It is important to understand that sildenafil does not automatically cause an erection. Sexual stimulation is still required for it to work. For erectile dysfunction, the usual starting dose is 50 milligrams, taken approximately 1 hour before planned sexual activity. However, it can be taken anywhere between 30 minutes to 4 hours before sexual activity, depending on individual response. The medicine should be swallowed with water. Taking sildenafil with a heavy or high-fat meal may delay how quickly it starts working, but it does not reduce its overall effectiveness. Depending on how well it works and whether any side effects occur, the doctor may adjust the dose. Some men may be advised to take a lower dose of 25 milligrams, especially if they are older or have certain medical conditions, while others may increase the dose to a maximum of 100 milligrams if needed. However, sildenafil should not be taken more than once in a 24-hour period. In addition to erectile dysfunction, sildenafil is also used to treat pulmonary arterial hypertension, PAH, which is a rare but serious condition characterized by high blood pressure in the arteries that supply the lungs. In this condition, the heart has to work harder to pump blood through the lungs, leading to symptoms such as shortness of breath, fatigue, dizziness, and chest pain. By relaxing the blood vessels in the lungs, sildenafil helps reduce the pressure in these arteries and improves the ability to exercise and perform daily activities. For pulmonary arterial hypertension, the typical dose is 20 milligrams taken 3 times a day, usually under strict medical supervision. Because sildenafil causes blood vessels to widen, it can lower blood pressure significantly. For this reason, people who already have low blood pressure, are dehydrated, or are taking medications for high blood pressure should use sildenafil with caution and only under medical advice. One of the most serious and dangerous interactions occurs when sildenafil is taken together with nitrate medications such as nitroglycerin, which are commonly used to treat chest pain, angina, or after a heart attack. Combining these medicines can cause a sudden and severe drop in blood pressure, which can lead to fainting, stroke, heart attack, or even death. Therefore, sildenafil is strictly contraindicated in patients who are using nitrates in any form, including tablets, sprays, or patches. Like all medicines, sildenafil can cause side effects. The most common side effects include headache, flushing of the face, nasal congestion, indigestion, and dizziness. These are usually mild and temporary. However, a rare but serious side effect is priapism, which is a prolonged and painful erection lasting more than 4 hours. This is a medical emergency, and immediate medical attention is necessary to prevent permanent damage to the tissues of the penis, which could result in irreversible erectile dysfunction. Sildenafil may also cause visual disturbances in some people, such as blurred vision, increased sensitivity to light, or a blue tint in vision. If any sudden loss of vision or significant visual changes occur, medical help should be sought immediately. In rare cases, sudden hearing loss has also been reported. It is important for patients to inform their doctor about their full medical history before starting sildenafil, especially if they have heart disease, history of stroke, liver or kidney problems, blood disorders, stomach ulcers, or anatomical deformities of the penis. Alcohol consumption should be limited when taking sildenafil, as alcohol can increase the risk of side effects such as dizziness and low blood pressure, and it may also worsen erectile dysfunction. Sildenafil should only be taken under the guidance of a qualified healthcare professional, and it should not be shared with others, even if they have similar symptoms. The dose and suitability of the medicine vary from person to person, depending on age, overall health, and other medications being used. Always follow the instructions provided by your doctor or pharmacist carefully. If you experience any unusual symptoms or have concerns about the medication, consult your healthcare provider promptly. Proper medical advice ensures safe and effective use of sildenafil, helping patients benefit from its therapeutic effects while minimizing potential risks.